Fantastic, fantastic. A fantastic morning for you all, but for us, it's evening here. Just give me a minute. Let me settle with my recording. All right. A very, very good morning to all of you, and welcome to all the dignitaries, faculty members, and if anybody is new to our Bioquantum Academy and today's conference, I welcome you all. So on this beautiful day, the 25th of April, now I need to let you all know that this moment, at this particular moment of my journey, and after listening to Dr. Parveen, my mind, my brain, everything has paused. The reason, she has nailed every information of philosophy and the science of medicine to such an extent that I feel, do I need to present here? Do I need to share anything here? So, with that little confusion within me, but my inner gut feeling is telling, yes, she has done a great job. But now, with philosophy from a different perspective, from my inner being as a human being, I would like to present this beautiful information so that you all understand exactly of what is my perspective and what exactly can we pick up from this particular topic. So thank you all once again, and thank you, Dr. Parveen. It was fantastic and mind-boggling for me. But at the same time, I need to retune my presentation as well because I had a pre-planned what I need to, but after you came in, now I need to retune, recorrect a little bit phrases and information sharing on this particular topic. Thank you so much. You really tickled my brain. And right now, as you said, philosophy is something you need to look into yourself. So now my inner energy fields are working. So coming back to the philosophy of healing and the science of medicine, it's a beautiful topic, which normally, if you're looking at from a medical perspective, nobody will look into it unless they are a little open and accepting the views from other modalities of treatment or healing or other modalities of subjects, which is available right now on this platform Earth. Now, saying that, the most beautiful part of our journey, what is the foundation of restorative practice? Now, what do you mean by restorative practices? Whatever changes from its main path of, we have to restore it back. Now, be it a fever, be it a ailment, be it a disease, we need to restore it back to original situation. This is what we all are practicing. Now, this is where a doctor plays a very, very important role. Now, so when you look at the understanding of the philosophy of healing, now these, whatever I'm sharing with you all, is never taught in our regular allopathic medical practices. Now, the philosophy of healing explores the underlying principles, values, and beliefs actually that guide the process of restoring health and the wholeness, integrating the mind, body, and spirit perspective for a patient care center. Now, this is something very, very important. But if you look at the real medical fraternity, they do claim that they are, patient-centered. All these is there, but in reality, as Dr. Parveen expressed it very clearly, many a times it doesn't. Actually, it's a crumbling block which is happening right now. Whatever diseases we faced probably 30, 40 years, and we are still going on with those. Like I would, as Dr. Parveen was talking about cancer, for me, more than cancer, I'm looking at diabetes. Which is a very, very simple dietary disease. But if you look at in the past 50 years, the number of clients have increased. Now, why is that? Because nobody goes to the root cause of the problem and nobody finds a solution for it. Now, as she beautifully showed us that the philosophy is the frame of the house and the remaining all are fitting inside this as different rooms, but can be changed as and when necessary. Like AI technology, which is one of the rooms can be accommodated in the process of healing. We can do that. So in that, if the framework is properly done, I think our body, our healing process, everything starts doing its job the way it has to. So that means the biggest challenge for every one of us is we need to get back to nature. Now, whether you call it is a philosophy of healing or you're getting back to nature, but at the end of the day, only when you understand what is this nature all about, then you can understand what is that particular nature which is existing inside our body as well. That is when you will know what exactly is happening inside you. Now, we have been taught, we have been told, and we have been guided to see everything external. As Dr. Parvin very beautifully said, science, we see everything outside. You see through a microscope, you do everything, but you do have a methodology, you do have a protocol, and you do have certain guidelines as to what, how, and you need to proceed with those, whatever inquiries or research, or it can be looking for more information more deeply. Now, when we look at externally, yes, it's good, but can we pick it up and apply it to our inner journey of life? That becomes a challenge for us. Now, that becomes a challenge means, for example, as she very beautifully said, just take one tablet of paracetamol. It's a tablet which is externally available. The moment you pop in, now, is it going to balance your system? I don't think so. What it does, of course, your fever, which is a natural phenomena of your body for any foreign objects, the fever or the temperature rises, which is a natural phenomenon of the body. That means it is the way the body is manufactured. But what we are trying to do, we are taking a tablet and thereby just we are covering up those symptoms and thereby we feel good. And we as human beings, we have accommodated to all the external comforts, external factors to such an extent that we have ignored everything what our body is speaking. We have stopped listening to our body. And that is how today we are facing a challenge in terms of healing. Now, healing has to happen. There is a lot of steps we need to, which I'm going to show you right away. Now, when you look at the principles, the very core principle of healing, and I'm just including the word epigenetic because it's a bigger umbrella of whatever subject I'm discussing today is a bigger umbrella, is epigenetics, which holds everything inside. Now, one of the core principle is holism. Now, can you believe this beautiful word? I picked it up just a week ago, and then I felt there is something new for me. Then I really went inside, and then when I saw exactly what is holism is, it includes your physical, emotional, mental, and spiritual dimension. Now, this is something very, very beautiful. But if you look at the regular medical field of treatment, what happens? It's more of physical. When you give a symptom or when you say you have a pain, the doctor is going to see you at that particular whatever physical situation is, and then immediately a prescription comes automatically, and then it's treated. But many times you would notice that many of my clients, this is in my clinical practice, I notice that there are a lot of emotional barriers which are involved in every individual's life journey. The only thing is they will not come and tell you that I'm having some emotional disturbances and that's the reason I'm having this problem. And many times it's called psychosomatic diseases, wherein the person has some emotional disturbances and that in turn will manifest in the form of a disease. Now, holism is something you need to include everything together. Now, this is one part of our healing process. Now, the second part of it, if you're looking at, there needs a balance and harmony. Now, are we balanced? Now, this is where when you look at the philosophy, philosophy is something where I noticed that Dr. Parvin is repeatedly talking about empathy. Now, this is a situation where if you are an empath, then automatically you would like to balance. Automatically, what happens is you see someone in front of you, you would rather go into that particular person's shoe and say, and understand that what problem they are going through, and then you would like to give a solution for that particular whatever problem they are going. Now here, so in that way, the balance plays a very, very important role. Now, if balance plays a very important, then what does harmony does? What I understand is the moment you start having a balance, harmony automatically starts fitting into it, and then it starts working the journey towards homeostasis. Now, homeostasis of the self plays a very important role, and homeostasis of the environment plays a very, very important. Now, this is where the balance and harmony as well plays a very, very important role in, and it's one of the core principles of healing. Now, finally, what we are doing is we are talking about the patient-centric. I would put it as client-centric because I don't call anybody as my patient, I call them as my client. Because patient is a word which we use in a hospital. You have a disease, then you're named as a patient. But for me, I don't see anybody who comes to me as a patient because I don't see it as a disease. What I see is probably there are some metabolic differences or metabolic changes which need correction and which we need to go inside. Now, this is my epigenetic analysis helped me in the past 10 years to go inside, pick up what exactly is happening at the cellular level, and then we correct it. So what happens is it is more towards an individual correction and then support this particular whoever client came to you and then heal. See, ultimately what happens, everything boils down to healing. Now, healing is a very, very, I would say, a 360 degrees wider, wide angled concept of life, which many of us don't understand. Most of them, healing means they are talking where probably you transmit some energy, and you go for some Ayurvedic massage or some treatment there and you get yourself healed, or maybe you just play some light music and then sit down. That is also a process of healing, but healing is much more deeper, which I'm going to share as well. All right, now what is this transformation in the healing which is happening right now? Now what we all need to understand is healing as as a dynamic evolving process rather than the fixed outcome. So that means a process of healing, you can't predict that this is what is going to happen. The reason is every individual body or every individual human being, even though we do have the same physical structure inside our body, but when it comes up to the way it functions and the way the homeostasis happens in our individual bodies and the healing takes place will be different. So that is why there is nothing like a fixed outcome in the process of healing. This is number one. Number two, you need to understand that embracing a change and growth is an essential element of restoration. Now, for example, the most beautiful part of today's medical sciences with the AI technology, you need to embrace the change. You cannot say that 50 years ago, this is what I practiced in my medical field and this is what I'm going to continue. It won't work there because you need to embrace the change and the change of how our physical body has been expressing itself. We can call it as our gene expression and our epigenetic, but in general, I would say each human beings, their way of expression of their issues or the problems in their life is totally different. What 50 years ago our great grandfathers and our grandfathers used to handle their life was different. But today, in just a few seconds with your mobile phone, there are a lot of solutions you can go for, and you can find solution just instantly. Like those days, there was nothing like where you can record, save, and then re-see it or re-record or retake that particular information and then listen to it. There was nothing like that. So that means what was happening with our ancestors was they were all philosophically going inside themselves, questioning, why is this? Now, what should I do? How can I upgrade? How can I connect to this universe and get more information? And this is where they used to measure and visualize things which you and I today, with all the advent of our latest technologies, we are still not able to exactly measure and give the exact what is happening. Just like, for example, cancer. In cancer today, it's very easy for a doctor to let you know that, hey, you're in the stage 4 cancer. Now, how is that the person has not even recognized the stage 1, 2, and 3, and finally lands up with a doctor, and the doctor frames it as a stage 4. So what is happening? Because we have ignored. We have ignored our body's signals. We have ignored our body's inside talk. We don't listen to our body. So what happens? Automatically, you pay the penalty in the form of a disease which is not being controlled. And at the end of the day, you have to look forward and you have to wait for another division of doctor who is supposed to be an expert in cancer treatment. And what does he do? He will treat you from external part only. And does healing happen? No. This is something very, very important that we need to understand. Now, finally, if you look at the recognizing each healing journey as a unique and a continuously unfolding situation. So the moment I am talking about recognizing healing journey means, for example, maybe last week you had a fever and then you recouped from it and then you moved forward. But you can't expect the body to act the same way today after 1 week or maybe after 1 month. The same way the body, sometimes the body might take a little longer for it to heal. Maybe the first time it was 1 day and the fever vanished away. But the second time, maybe it's taking 1 or 2 days, or maybe the organisms are a little more stronger. So here what happens is in the healing journey, it is unique, but there is something new continuously unfolding. So when you look at the healing, there is a lot of transformation happening within us as of 2026. So saying that, what shall we do now? Now we need to know a little bit of what exactly, this is where I'm comparing our philosophical approaches. Now let's look into our Western biomedical model. What does it do? It just focuses on the pathology, diagnosis, and physical intervention. Now this is very, very clear. What the client comes with, the doctor focuses on that, and then he just goes ahead and then looks forward for it in the form of a blood test or maybe in the form of a scanning. He gets the result, and the moment, as per his knowledge and information which he has acquired for that particular situation, what will happen? He will make a diagnosis. Now this is a must for the Western medically trained doctors, is you need to diagnose. That means you will have a diagnosis. Now, the moment you cannot make a diagnosis, there is a word called idiopathic. Now, this is where idiopathic means we don't know. But at the end of the day, even in an idiopathic situation, we still go on investigating, and finally we find that there is nothing much we can do. So what we do is we give some symptomatic relief and then we send the patient back. But coming to our Eastern tradition, where the emphasis is on energy, energy flow, the balance, and a holistic harmony. Now, this is where I proudly let you know all that in 1997, I learned a method of healing called Reiki. Now, this is the first time I went into, as an allopathic doctor, I went inside, and when I saw that energy and the healing, I was really amazed because there were a lot of things which in our regular medical allopathy, we don't believe in it. The reason we don't believe is our mind is being bombarded with a knowledge where we see, we need to see that, and then only we. Now, energy is something, how can you see it? Even though today we have a GDV camera, we can show you an energy field, but still, even today, if I'm going to show someone the GDV camera, they still don't believe in it. I don't understand why because they have been, the belief system and the conditioning of their mind is so hard that it's like a nutshell where you can break it. So coming to our Eastern healing tradition, it's beautiful. Ultimately, you see everything is happening there, but that is not going to help us. The reason is even the Western medical, whatever our allopathic medical science has gone too forward ahead, wherein there are a lot of breakthrough technologies which the today's medical science has done wonderful, wonderful, wonderful. In terms of giving the solace to our clients, it has done a great job. I'm proud of it. But on the other side, the Eastern healing tradition also, they have transformed, they have gone way ahead and equally walking along with the allopathic treatment module. And I see a lot of patients or the clients being healed through natural means. I've seen cancer patients being recovered fully without any intervention of the medical fraternity with chemotherapy, radiotherapy, or whatever therapies you're talking. But these beautiful souls have started using the Eastern healing. Now, this is where I am here to share this beautiful knowledge of integrative medical approaches which Bioquantum Academy had already prepared a beautiful platform wherein we can combine the evidence-based medicine with the complementary modalities, and that is where the niche or the epitome of our healing is multifold, exponentially. We can do a wonderful job. This is where the integrated approach is going to be the future. And this is where, as medical doctors, we need to look at from 360 degrees aerial view so that you will be able to understand what your body is. And then, of course, you can apply your the clinical medical knowledge and in a complementary way so that you give an opportunity for your body to heal. Now, what Hippocrates told about healing, it's a matter of time, but it's sometimes also a matter of opportunity. Now, what does he mean by opportunity? Now, most of us, what happens is we have been tuned, we have been bombarded with information from the outside. Now, many times we lose an opportunity of healing. Why? Because we have been told from the external information and the knowledge what the other people, or maybe the people who have experienced from the other modalities of treatment, that this is what is the only way for you to move. So what happened? Even though the nature will give you something beautiful, but you lose an opportunity because many a times we don't grab the opportunity which nature gives you. So this is where I would definitely look into and let know people that you need to be in harmony within yourself. There must be a proper homeostasis within yourself. And when you look at the whatever the message down here which I have put, it reflects on your practice, and also it shapes your philosophy, and then the embrace, the healing wisdom, which Dr. Parveen has been repeatedly telling, the wisdom. Now, wisdom is not something you can buy from a shop. And wisdom is as you walk, as you're living on this planet Earth, each human being on this planet Earth has different wisdom. Now, at the end of the day, if the wisdom can be applied at the right time, at the right place, with whatever practical knowledge they have and whatever external knowledge of the medical knowledge they have, if it can be incorporated and integrated, I think the wisdom works fantastic. So it doesn't mean that my wisdom is superior or another person's wisdom is inferior. No, everybody's wisdom is good, provided we understand that we need to use the wisdom practically, so that if you can find a solution with your wisdom, then that means your wisdom is good enough. Now, many a times, or maybe sometimes, your wisdom, what you apply, may not give a fruitful results at that moment. But definitely, if you are in alignment within yourself, in a proper homeostasis, definitely you will be able to definitely heal yourself, and your wisdom will be able to bring in some kind of understanding. So now where are we? So I just want to elaborate a little bit of this holism, this particular new word. I'm excited on this particular information. Now, what this holism refers to is an understanding that human being by is not just a collection of separate parts. Now, this is sometime most of the time I do let know people that we have to have a holistic approach right from head to toe. This is what we need to do. But in medical practice, what we have been tuned and told is we have different departments. Now, that is where the problem is. One department doesn't speak to the other department. For example, you go to a heart problem to a cardiology department, and you have some problem with your kidneys. Your cardiology doctors will not be able to speak or doesn't speak to the kidney specialist. Now, if both are not speaking, what happens is both of them are going to give you some separate whatever diagnosis and separate treatment module. Now, what happens? You, as a beautiful being, sincerely, you accept everything and you start consuming, only to find that after some time, you get into another problem, which another department will come in. And finally, what happens? You will be running from pillar to post. Now, this is where it should be. Holism is an integrated whole where all the dimensions are interconnected. So in that way, in this perspective, we are talking about the physical body and emotional state. Now, emotional state plays a very, very important role in our journey of life. Why do I say that? Because I've been doing a research for the past 20 years on energy field, and I feel if your emotion is not balanced, your energy fields are affected. The moment your energy fields are affected, there is a lot of disturbance metabolically as well inside your body. For example, what I can tell you is if your energy fields are low, your healing is delayed. It's an automatic phenomenon. And that's why I noticed that a lot of people who are all in the low frequency, they do go through a lot of physical challenges in the form of diseases. They'll have multiple complaints. They will have multiple complaints. And all through their life, they go on complaining. And then ultimately, what happens? You are actually adding on fuel to your existing physical disabilities and diseases, and there is no healing happening. So, this is something very, very important. And then, of course, the mental process and the spiritual well being continuously influence one another. So, that means they are all intricately interconnected between them. Now, for example, as I told you, if you are having a chronic stress, maybe mental or emotional, can manifest as hypertension or immune dysfunction in the physical form, while a sense of purpose of inner peace of the spiritual can promote healing and resilience. Now, this is where a lot of people experience the healing happening the moment they meet a particular spiritual master or a spiritual dimension of healing. Everything starts changing. Now, that is when they understand that they they can heal themselves. Now, here, once again, going back to inner self. So, holism emphasizes that true health is achieved not merely by treating the symptom, but by addressing the root cause across all these dimensions, restoring a balance, harmony, and optimal function of the whole person. Now, when you're talking about holism, that is where I can let know every one of you that epigenetics is the, I'm underlining this word, the beginning of the future medical sciences, where it covers everything. In epigenetic, everything is covered at the same umbrella, whether it's you're going to be a medical doctor or you want to be a healer or you're going to use other holistic methodology, everything is under that same umbrella. So fantastically, holism comes under. So I'm very excited that I'm in the right place with the Bioquantum Academy for me to share my knowledge. Now, this is something for just for information. I put this slide because I wanted your brain to be tickled a little bit so that you understand 3 billion years ago, there was something called cyanobacteria, the only single cell organism. There was nothing else, And what was the job of this particular cyanobacteria was the whole earth was filled with only carbon dioxide, nothing else. See, today at least you have an oxygen to breathe and you're able to live here. But those at that time, 3 billion years ago, there was no oxygen. So from where did this oxygen come? Now, this particular cyanobacteria, the lifespan of this bacteria was only 7 days. Only 7 days. So job of this particular cyanobacteria was they used to take in the carbon dioxide and give out oxygen. Now, can you believe how many years it would have taken for these guys to sacrifice their life for 7 days, sacrifice and then reborn, die, reborn, and convert the whole set of carbon dioxide into oxygen so that you and I are breathing today comfortably. So can we call this beautiful cyanobacteria as our ancestors? I would say yes. Why not? Our ancestors were cyanobacteria 3 billion years ago. So now, once we understand that today you and I are sitting here on this platform, Bioquantum Academy, do you know how many sacrifices our Dr. Parveen would have done to be in this state of 10 years? And, with the kind of different, government bodies and with different people for us to comfortably come and sit here and then discuss this particular, whatever topic we are discussing, what kind of sacrifices. So the same like our cyanobacteria, which sacrifice, today we have a lot of faculty members and beautiful souls in this beautiful organization, and everybody is doing a fantastic sacrifice. So from the bottom of my heart, I would like to extend my heartfelt thanks to all the beautiful souls who are doing a great job. Now, saying that, so this is just for you to understand that last time, how much was your carbon dioxide and today, how much is your oxygen? It has increased exponentially. And this is where today we need to be thankful to all the beautiful souls like our ancestors and other people who have sacrificed their life for us to live a comfortable life today. Now, saying that, there is one connection between our galaxy and our body. Now, what happens? These galaxies collide to form a iron. This is I didn't know that there is something existed like this, but today I'm sharing with you. If an iron is formed and which gets transported to the next, just like our RBC is carrying the iron in our blood with the oxygen. So that means what is there in the universe outside you is there inside you as well. So we are not different. We are the same. Only thing is we feel that we are different from the universe. So the moment you understand that we are all the same, life becomes much more easy for us. So now coming back to our healing. So if you're talking about philosophy of healing, healing has been happening for billions of years, millions of years, 100,000 years, 10,000. It's been happening. Now, is it that only today you and me are listening to a word called healing? No, it has been there. So what has been is our human body has been healing various injuries and situations naturally. And there were no doctors, there were no healers. Only magic was by nature. By our body was well prepared and well educated and well, I would say, documented for it to do its job and very well automated so that it could do the healing. Now, the very basic philosophy of healing is our body is manufactured to take care of itself in case of healing or cure after an ailment. Now, it's naturally done. So, are we allowing our body to heal itself? Now, this is where we need to understand that today, as Dr. Parveen repeatedly telling that the whole system is crumbling down. The reason is they are not able to fit into the original philosophy of healing. Now, this is the reason. Now, this is where what you and I should do is we need to go out and then extend this knowledge to let know people that it is only through integrated approach, it is only through philosophically looking into your own self, it is only through the homeostasis of yourself to the universe you shall be able to give a proper healing, and at least in the future our future generation can live a healthy lifestyle. So
Thank you,
the
Dr.
question is,
Kumar. Excuse me, it's actually 10:33 and you're 3 minutes over. So if we can conclude the conversation and we can move forward. Thank you so much, Dr.
absolutely,
Kumar.
absolutely fine. Thank you so much, Maria. Thank you.
Okay, so now if we can go to some Q&A, some questions. Does anyone have any questions? In the meantime, for Dr. Parveen and Dr. Kumar.
Thank you so much, Dr. Parveen Zareen and Dr. Kumar. Um, so, Dr. Kumar, I just wanted to ask you something. Now, most of the things that you have talked, I have correlated that to homeopathy in my presentation, like, homeostasis, vital force, so you'll understand, like, how we correlate all these things in homeopathy. All right.
Absolutely.
And now, so one thing that I wanted to ask you was, you told that, our body has that natural healing capacity. 100,000 years ago, like, we never had any medicines and our body could heal itself, right? But now in modern days, in today's era, in today's world, what I feel, this is what I feel, that healing capacity that we used to have, has diminished. Our body is not able to heal the same way as it used to. Probably it could be because of the environment, it could be because of the stress that we have in our world today. Every time, we throughout our years of our lives, we are constantly in that high cortisol, high, stress
Stress.
level, right? And I think probably that's the main reason why, our body is not able to heal the same way as it is used to be. Now, from homeopathic perspective, we know, like, how we can heal that. But now, leaving homeopathy aside, what do you think can be done so that our bodies, can heal, or we can bring back our body to the same stage or same state how it was, like, 100 to 1,000 years ago?
Okay, very, very simple solution. What I can and what I follow is the moment you get back to nature. For example, if you can spend a little time every day walking on a grass, spending a little time with nature, trees, and if in your home, if you can have a lot of plants, things will be a little more easier. This is number one. Number two, we all have to understand and learn that how our body works naturally in its own way, and how healing processes is being constructed by the divine for us to give an opportunity for your body to heal. But most of the time, if you're going to pop in a pill for everything, there is no pill for every ill. So in that way, the conditioning of the whole generation of people is so much that they are into total medication. Now, what we need to do, for your question, what we need to understand, the first thing is to educate people. The educating people is the prime role for every one of us, so that at least in the future, maybe it may take another few years, but from your point of view, as a homeopathic doctor, probably you're all doing a great job, because you're already, when someone comes to you, their approach is much easier. Whereas with us, most of the time we see people who have been drugged, they have been taking medication, and when they come to us, but in epigenetic in the past 10 years, Faisal, it's fantastic, because I spend more time on educating and helping our clients to recoup back by getting back to the nature. So ultimately, it's education, getting back to nature, and you need to look into yourself. You can't be looking outside for a healing to happen by another person. But I think in your field of medicine, you people involve and you people allow your clients to heal by supporting with the natural whatever products you all have, helps them to heal faster. So I think you're all doing a great job, but it's a challenge for us.
Thank you. I think it's a challenge for everybody now. Dr. Zain can agree with me, because even to us, when the patients come to us, they have already taken tons and tons of
Yes.
medicines, and it's very difficult to undo that. They are like they have that habit, anything happens, they will not wait for a moment, little pain, and they will pop
Immediately painkillers.
acetaminophen, so it is very difficult to teach them how to unlearn that, it is difficult,
Correct.
right?
But here I would like to share another information. See, if you're in harmony with yourself, in a balanced journey of life, your body will never go through any kind of aches and pains. It will not. And by chance it is there also, you will not reach for a pill, but you will see how naturally can you heal yourself. This is what I do. And at this age, I'm very healthy. I run my life beautifully. The reason is I'm in blend with the universe. That's something beautiful.
Beautiful. Thank you so much, Dr.
Thank you.
Kumar. Thank you so much.
Fantastic, Dr. Kumar. That was, as always.
But still pending, a few more slides are there. Maybe let's see, if time permits, I would like to share that information later.
Yeah. We have a couple of hours at the NOV conference, so it's at the round table and what you call a discussion.
Absolutely.
Yeah, so we can. Dr. Kumar, you're not sleeping tonight. I'm so sorry. As you promised, you're not going away. So you're staying at the end of the conference. So
today I'm on duty. I'm on duty here.
You're on duty today.
That's
yeah, everybody is in the army today.
The philosophy of duty.
Yeah. So yeah, we're gonna have a great discussion, all of us. So we're gonna share personal views as well. So but the Q&A, I think it's good to answer questions specifically. So, but then yeah, keep the slides for them then. Any other questions? Dr. Maria, thank you so much for being a great moderator today. So
no problem.
I was so dissolved in Dr. Kumar's talk, and I didn't know the time is over.
No.
If you can,
Maria, I would have really appreciated if you could have tinkled me a little before 10 minutes ago. I would have just, wound up in a little more. I would have completed. Anyway, thank you so much. But I think for the next speakers, give a tinkle for them 10 minutes in advance so that they can prepare.
Yeah.
No problem. No problem. We just get so much immersed into the conversation that we're like, oh, wait a minute, hold on, time is up. But I was so mesmerized. I said, oh, we have to stop him now.
I think Maria thought maybe somebody else. I am doing the moderator because maybe that's what she thought. And
oh, I see.
Yeah,
I just got carried away. I apologize.
Yeah, you were so dissolved in Dr. Kumar's thought. So, but again, if the next speaker is Dr. Rasul, is it Dr. Rasul is in the house?
I'm not seeing Dr. Rasul.
Maybe under different names. Dr. Rasul, are you there? Because he's already been scheduled. I don't see Dr. Rasul. Maybe he just messed up the time. But anyway, maybe we can go to the next speaker, then keep the space for Dr. Rasul because he's joining from Pakistan, and maybe the time zone is a little bit, messed up.
Okay,
So-
so would we go with Dr. Ula?
Is Dr. Ula there? Yes, let me see. Yeah, I think after Dr. Rasul is Dr. Ula. Yeah, let's go to Dr. Ula now. But at the end of the conference, when we have time, we're going to have plenty of time. So Dr. Kumar can also go for another 5 minutes, maybe 10 slides. I can go, Dr. Faiza, everybody can go. So let's go according to schedule. And Maria, please keep your moderating job.
No problem.
Because I'm not a good candidate for that.
No problem, no problem. So thank you, Dr. Kumar, for the amazing conversation, mesmerized us. And now we're going to move forward with the Dr. Nayamat Ula, and his topic is homeopathy, integrative medicine, cancer care, foot melanoma, patient-centered healing. So Dr. Ula, the floor is yours.
Thank you, Maria.
And Dr. Kumar, if you can stop sharing. Perfect. Thank you.
Thank you, dear all. Good morning to everyone here, Professor dear Parveen Jerin, ma'am, and Dr. Prabhu Kumar, Alex Chauhan, Amanullah Bhuiya from Bangladesh, Dr. Leonardo Ruiz, Ramesh Maniam, Angi, Faisal Gira, everyone, and Fitria, Listari, Hesti, a lot of people are here. Everybody are good morning from Canada time and good evening from Bangladesh time. I hope there are a lot of people are here. Sri Sudoti, Nilam, Sari, Dr. Wan, Dimaj, and Heather, and Miss Maria. Everybody are saying hello. How are you, everyone?
You're doing great. Thank you, Dr. Ula.
All wonderful.
Great to
Thank you.
see you.
I want to start by sharing my slide, and I want to say story about COVID. After COVID, World Health Organization now said that no health without mental health. So World Health Organization also, after COVID time, they are concerned about mental health. So it's really important nowadays. So after COVID, in my country, in Bangladesh, there are more than 40 million people now are facing mental issues. And in my country, there are more than 180 million people, population are here. So after COVID, they are facing a lot of mental diseases. They are anxiety, suddenly they are getting a lot of high pressure, a lot of things. So mental health nowadays is a concern. Nowadays, every fitness product, e-commerce site, or every people now focus on mental health related product, mental health thing. So after COVID, our health sector is reversing. They are going to focus on mental health related or psychology related thing. So this is the story that after COVID we are facing. So thank you that give me chance to speak about a wonderful conference. Today is a wonderful day, Bioquantum Academy Media Academic Conference. And I am from Dhaka, Bangladesh. My name is Niyamatullah. I am a second generation homeopathic practitioner. My father was established this practice in this clinic, and I am the second generation. And I completed my bachelor in homeopathy, and now practicing in 3 clinic in Dhaka and outside of Dhaka. Here, more than lot of patients are come to take. More than 40% people are taking homeopathy in Bangladesh. We can use in front of our name doctor title, and government are really friendly in my country. So it's a great opportunity for homeopathy doctor in Bangladesh, that we can easily find homeopathic medicine for every pharmacy. So I can say on the basis of my perspective. So I will share some slides here. So this is the main story that I start from World Health Organization now concerning about mental health. And I want to say something that what is artificial disease is increasing in my country, and a lot of allopathic company, they are growing their business by selling their lot of antibiotic or a lot of chemical drug, which is hamper on our mental health, physical health, and also our other issues. Like if we will focus on cancer related cases in my country, there every year 1.5 million cancer patients are increasing in every year. And because most of the people, they don't find diagnosis here, and most of the patients are no concern about their disease. Lot of things, a lot of causes here, because they are so expensive in my country to treatment, allopathic treatment. Number one issue. Number two, they don't find proper doctor that they will easily give patient. Easily they can see patient one by one. Most of the patient, they don't find one by one doctor. Their patients quantity is high, but doctor quantity is really low. So one-to-one patient is really difficult to see. So most of the patients are most of the artificial disease patients are increasing day by day in my country. If I will show a result about that is antibiotic resistant in my country, in our daily paper, they are showing that 79 to 97% here are antibiotic resistant in my country. So it's a warming situation in my country. So what will do they? So I hope we are only neutral. We are only detoxification the patients, and now they are okay. In most of the disease, this 5 disease, diabetes, heart disease, this 5 disease is really concerning. It's like a booming day by day. This 5 disease: number 1, cancer, diabetes, heart disease, and stroke, and high pressure. This 5 disease is booming in my country. And 6th number, thyroid patient, is really increasing in my country. So they can easily find a drug. They go to the near pharmacy, and they can easily find this medicine without prescription. So patients are really prefer to take this drug medicine, because in my country there is no health regulations. It's growing the artificial disease. So what we will do from homeopathic perspective, we are only we are only neutralizing this antibiotic like patients. We are using suric medicine for these patients, and we detoxify the patient. They can go the nature, they find their harmony, they find their natural body, and it solves their issues. Like if I will say one patient, I want to share one patient. Her name is Ambia Khatun. She comes last couple of years ago, and her age is 42 years, and she got melanoma in foot. Okay, right foot, malignant tumor. Okay, melanoma of the right foot. And she also she had I had also right thyroid tumor, tumor under the right armpit, tumor on the sole of the right foot. Additional medical history, she has tumor growth observed after inguinal hernia operation, and she also take treatment from Kolkata Cancer Hospital. But after expense, she got that it's really expensive. Then she comes to my clinic and I gives her homeopathic medicine, and she relieves these types of tumor. So I use only simple homeopathic medicine. So what we focus in this patient, we focus one thing. This is not a partial treatment that we will treat only one part, one organ, on her foot. This homeopathy is not focus one part of the patient. We focus her vital force. I ask her, what your issues? She said she has pain, she has fear, she has also financial crisis, and she hopeless. She said, I think I don't uh, alive. So it's focus on a homeopathic medicine, and we maintain our protocol, and then we provide wonderful homeopathic medicine that called Calcarea flour. And this is philosophy of homeopathy, and I learned this philosophy from my father. And then after few months later, this patient's tumor is reducing day by day. So it's really a cost-effective treatment in my country, and most of the patients like this Ambia Khatun, we are getting day by day. So uh, what we learn from this patient, what we'll do if you got a disease, first you will go to the pharmacy, or you will uh, learn what is the story of the disease. Every disease have a story, okay? So without story, don't make a disease like diabetes or cancer or any kinds of thing. If we'll go the background, there we will find a story. So we should focus this story, and this story will be the call which philosophy we will count. Then we will use the medicine from Mater America. But story will be the really important to write down or note this story with attentively. If you will attentively read this story, we can easily remove these types of disease, and then we can focus and we can cure the patient. So this is the system of my protocol, MPT care protocol. We called MPT care protocol. What is MPT care protocol? MPT care protocol means M means Mukalip, P means philosophy, T means treatment. It's totally, we are focusing three things: individualized little particle of medicine, and easy homeopathic medicine. So we focus three things: women's health, reducing the cost, and MPT care protocol. So I hope in my country, after COVID, now homeopathy is really focusing day by day, because a lot of patients now antibiotic registered in my country, and we are using this 8 medicine for curing this artificial thing. Number one, most of the patient we use sulfur. Number two, we use Nax. Number three, we use Pulsatilla. And this 8 medicine is really help to remove this artificial detoxification. Pulsatilla, Anthusa, Ipecac, Aloe, Sepia, Carbopes. This 8 medicine is really helpful to us to remove this artificial disease. So I hope you enjoy and this thing that what happened in my country, because in my country most of the people they don't knowledge about their health concerns, but in modern science they are focusing on mental health. Most of the research are now focusing on mental health, because psychologically everything now are going to psychological product. Like if you go nowadays we find a ring. If you wear a ring, we can easily find which part our issues. But we find this diagnosis by using this AI or other tools. But which medicine we will provide? So you must be first priority will philosophy. Then we will come back to our diagnosis. So diagnosis also our finding our disease, but story this every case story if you define wonderfully, and we can go mathematical, then we can cure our every mental health. So end of the this lesson, I want to say that um, same thing with the World Health Organization that say there is no health without mental health. I hope you will enjoy this my lesson. Thank you. Thank you to everyone to attentively listen this space.
Thank you so much, Dr. Ullah. This is very interesting. Mental health. Well, that is something very powerful. If the mind is not there, the body can't heal. The mind gives the body the healing. So that is very good, very good. Thank you so much for this. And is there anyone that has any questions for Dr. Ullah?
I just want to make a comment. Thank you, Dr. Ullah. That was perfect, very excellent. So, yeah, when you say the mind, so in regards to my talk, say philosophy is a realm of mind, and science is a realm of physical. So when somebody comes to us for example, arthritis, right? We take 10 rubrics. I personally take 8 of them from the mind of the person. So that's why the mental health is on rise, because it's been ignored. So the realm of mind is philosophy.
Yes.
So that the pain, it's interpreted by science. So, and the terminology comes on, for it and whatever they call it, right? So that's why the mental condition is on rise, because they focus on the physical aspects of the person and completely ignore the philosophy aspect of the person, which is the realm of the mind. So this is very important to know. That's why I call homeopaths philosophy practitioners, not medical practitioners. So
nowadays, after COVID, World Health Organization also changed the definition of health. They are changing the definition of health. They are now saying that there is no health without mental health.
Exactly, because then again, the mental, it's come from the realm of the mind, which is again philosophical aspect of healing. So completely be ignored by the science of medicine. So that has been problematic. Thank you so much for bringing it up, Dr. Ullah. That was a great talk. And so as I said, I personally like to call homeopaths philosophy practitioners than science, than medical, and also the homeopathic medicine or narrative medicine, which is every single case there is a story behind it. So story of this person, a story of that person. And something that I like to make a comment on, you mentioned artificial disease, which I personally call it complex disease, because artificial disease is the one that we make it by homeopathic medicine. So it's like a very short-lived artificial, kind of disease that is removing the complex disease. So, but again, we understand exactly what you mean. It means it's not a natural disease. Natural disease is a natural state, definitely so easy to remove. But when it turns and converts to complex disease, it becomes so unnatural that you can't call it artificial. And we have a lot of artificial death. The cancer patients are all dying by artificial death because of, so they're born into the world of toxins of everywhere, everything, in food, in water.
Mismedication in my country, mismedication is really available in everywhere. Mismedication means
who does it? Medical doctors who do this, who are acting. The action is in the hands of medical doctors. Are they doing it by ethics? Are they doing it by logic? No. They're following it blindly. They're following the system blindly. That's why the problem that the peoples are not just like, they're drugged up. They're drugged up. And that's why we have to teach. The only thing we can do is just to teach, just educate them. And our job is to educate medical doctors. Please do not blindly take actions just because of science. You have more responsibilities towards life, every single life. And whoever is dying in the hands of any medical doctor, they are part of it. Knowingly, unknowingly, don't tell me that because of my training. Yes, they say because of my training. So your training is wrong. You can use it. You can use the science based on the philosophy. Meet at the point. So homeopathy is science too.
In my country, mans are like guinea pig. Last Faisal Gira, Dr. Faisal Gira, he said about we saw in vaccine related thing. I don't take vaccine, but in my country, in government, they are pushing to take vaccine, COVID vaccine to everywhere. But I said that we have a homeopathic medicine. So mismedication is everywhere. In my country, it's really easy. There is no health regulations.
It's your job, Dr. Ullah, to multiply people like yourself. And that's the only way. That's life. Life is full of challenges, you know. We can, you know, I did it single-handedly. So, and I'm in a spot that I'm passing it to everybody. But you can do it too. It's not that everybody can do it. It's your job. It's your responsibility. It's your ethic. It's your medical ethic to do it. And we're not going after anybody. We're not going to fight with anybody. It's over. We're not going to fight with the system, with the current system. It's over. We're just creating our own system. Whoever likes us, come with us. Whoever doesn't like us, leave us. Yes. We are not endorsing the system. We are not promoting the system. And we are not asking them to come with us. You know, and we are not asking them to include us. It's over because they don't have the framework of philosophy. It's done. It's a done deal. Now we have to move towards our mission and just do it. If they want to join us, more than welcome to join us. If they don't like us and they don't accept our perspective, hey, the road is open. So it's your job, it's my job, it's all of us' job to do it. The only thing we can do is teaching it, is educating, nothing else, right? You can practice homeopathy with your patients, but the patients, how many? They're not the whole world, right? But educating circulates around the world. Education circulates around the world. But patient is just yours.
Yes.
So don't think, I myself too, don't ever think that it's enough as a philosopher practitioner. It's not enough. You have to educate people. I educate my patients the same as educating my students. Because I say, tomorrow maybe I'm not around. I don't know. My life might take me, right? Somewhere that, you know, God knows. You have to be educated to take care of yourself because you cannot be relying on homeopaths for the rest of your life. When you're understanding the philosophy of healing, then you're already stepping into philosophy of homeopathy, and then you can go for it. Then then go to the science and understand the materia medica. So this is our job. Yes. to do it, and I'm sure, Dr. Ullah, you're doing an amazing job in Bangladesh. And but that's how the thing, you know, the problem around the world is. We can't do 100%, but we can do as much as we can. So, and thank you so much.
Thank you. Thank you. Thank you. Thank you.
Thank you. Thank you so much, Dr. Ula. And now we can actually go to our next speaker. If Dr. Ramesh Maniam is ready, and he will be speaking an integrative approach to cardiovascular health from philosophy of healing to clinical practice. So Dr. Ramesh, the floor is yours.
Dr. Ramesh, he was here for yeah, he's here.
Yep, he's here. He's here.
I'm here. I'm
Yes,
here.
Yeah, Dr. Ramesh. So I just want to have a little bit of introduction, Dr. Ramesh. Dr. Ramesh, he just graduated from epigenetic department with Dr. Kumar, and I personally joined his class, and it was fascinating. And congratulations, Dr. Ramesh. And now, as Academy's policy, we always invite our graduates to join us as a faculty member. And that's the first time Dr. Ramesh is going to present, because today conference is only us and only the members. And I want to welcome him as a member of the Academy and for the conferences from now on. And we look forward to your presentation. So.
All right, sure. Thank you. Okay. Just to check, can everyone see my slide?
Not yet.
Not yet.
Okay. Okay, just a minute. I have an issue. Can see my slide?
Okay, good. We're all good.
Okay. Okay, shall I start now? Sorry,
Yes,
sorry
please.
for the glitch. Okay, so first of all, thank you so much for this opportunity. I have to thank Dr. Parveen and Dr. Prabhu for giving me this opportunity and to accept me into this BioQuantum Academy. I'm very much delighted to be part of this. And today I'm going to speak about an integrative approach to cardiovascular health from philosophy of healing to clinical practice. I'm Dr. Ramesh Maniam. I'm from Malaysia, and I'm currently practicing functional and integrative medicine for the last close to about 1.5 years. Before that, I was fully into modern medicine, and I found that there was something else that we are missing in modern medicine that actually brought me into this functional integrative field of medicine. And then later on, I met Dr. Prabhu, who is my mentor when I was still a medical student. And he told me another dimension of medicine called epigenetics. So I picked up that, and I'm still new learning from him. So I will start my presentation now. Okay, so in regards to cardiovascular problems, right? So what is the issue today? So we still deal with the number one cause of death globally, cardiovascular disease. It is still the number one cause of death. 17.9 million deaths per year as per WHO fact sheet. And Traditional evaluation focuses on structure but not function. Medications and interventions do not address root causes. And we are also treating the disease without restoring the health. So where are the gaps? The gaps are symptom-focused care, structure over function, which means, for example, angiography may show blockages, but it does not explain the dysfunction, which is why patients, sometimes they go for their second stent, the third stent, and so on. But the disease progression does not stop. Siloed approach, because we believe in integrative medicine, we should look at disease as a whole. We should approach holistically. However, in modern medicine, we still approach this in silos. As what Dr. Prabhu mentioned earlier, sometimes the consultants don't speak to each other. For example, a nephrologist and a cardiologist, they do not manage the patient together as a whole. And one size fits all treatment. That is another issue when it comes to the current modern medicine treatment as far as cardiovascular disease is concerned. When we see patients, they are all coming with a similar set of medications, and we see the same dosage, and it does not match with each and every one of them. Okay, so now let's jump into the theme of our conference, philosophy to clinical practice. To me, hearing from Dr. Parveen and Dr. Prabhu, I think my understanding of philosophy healing, I have to broaden it up further. However, from my little knowledge, what I understand about philosophy of healing, body is self-regulating. The body has innate intelligence to maintain balance. The body, the health equals to balance. That means optimal function occurs when systems are in harmony. Disease means dysfunction. So the disease arises when regulation and function of the body are impaired. Now, as what Dr. Parveen said earlier, this is the foundation of the house. Now let's go into the science, which is the renovations that happens inside the house. So in science, or what we call as biology, balance is reflected in key biological system. There are 4 different systems are interconnected with each other. Dysfunction in one of it affects all. The 4 systems that I mentioned are metabolism, which regulates the energy, hormonal balance. Next, inflammation. Inflammation can be protective in acute state. However, it can be harmful when it becomes chronic. Mitochondrial function, what produces energy and governs our cellular efficiency. And the 4th one is endothelial function, which I'm going to focus more today because this is related to cardiovascular, because endothelial function maintains vascular tone, integrity, and homeostasis. Okay, now we have the foundation of the house, we have renovations inside the house, but we also need somebody to bring the people to come and show the house. And that's where we as practitioners, we come into the picture. We need to apply all these into clinical practice. And how do we do it? System-based assessment. We look beyond the symptoms. That is what I've learned the last 1.5 years from my training under Dr. Prabhu. We look beyond the symptoms. We address the root causes. The root cause that covers all the biological systems, and we integrate various forms of therapies, starting with lifestyle, followed by nutrition, and many other evidence-based therapies that we often overlook or we do not follow in modern medicine. So earlier I've already mentioned about the biology of cardiovascular health. So these are 4 interconnected systems with one outcome: metabolism, inflammation, endothelial function, mitochondrial function. So balance is health, dysfunction is disease. Now from biology, let's move into the question, what actually causes chronic illness? So this is what is reflected by this metabolic triangle. These are interconnected drivers of chronic disease. Starts with insulin resistance. We often see this among our patients. They come with cardiac problem. They claim they are heart patients, but when we look into the root cause, it all started with an insulin resistance, which was not addressed earlier, or which is still not being addressed, which is why the patients go for repeated treatment, stenting, and ended up with a bypass surgery. Mitochondrial dysfunction, where patients have been suffering from reduced energy production, cellular efficiency, they complain of brain fog, and it goes on and on until one day they develop a heart attack. Inflammation, as I mentioned earlier, yes, we need acute inflammations which are useful for us. However, chronic low-grade inflammation, especially caused by stress, is very dangerous. And this combination leads to systemic dysfunction. And what happens next? The chronic diseases, not just the cardiovascular, everything else, diabetes, hypertension, and many more. So what drives the metabolic triangle? This is a very busy slide. I'm not going to go through this, but in general, our diet, our food, alcohols, smoking, poor sleep habit, stress management, stress at work, stress in our daily life, sedentary lifestyle, all these combine, and they are the factors that drive the metabolic triangle out of balance. So we have understood metabolic dysfunction, and how does it then create a vascular problem? Okay, so metabolic dysfunctions, as we know, insulin resistance is a combination of insulin resistance, chronic inflammation, mitochondrial dysfunction. They lead to endothelial dysfunction. And endothelium, as we know, it is not just a lining, they are actually an organ by itself. So what it does, it controls many things. One of it is dilatation of the vessels with production of nitric oxide. But due to the metabolic dysfunction, we have endothelial dysfunction. So what happens? We are low in nitric oxide, increased oxidative stress, pro-inflammatory activation. So the vasodilation, what we mean by dilatation of the blood vessels so that the blood can flow well, all these are impaired. And when this happens, obviously our tissues become hungry. They are hungry for oxygen, they are hungry for nutrient. And what happens next? The tissues goes through what we call as hypoperfusion, lack of blood supply, and this leads to injury. And one day we see patients having heart problems, heart attacks, stroke, and many other serious conditions. So as I mentioned earlier, metabolic dysfunction leads to endothelial dysfunction and impaired perfusion. This is what I mean by systemic dysfunction to clinical disease under the vascular model. So here, please take note, this is a very key point here. The vasculature is the final common pathway of disease. So it all started, as mentioned earlier, system dysfunction leading to endothelial dysfunction, leading to vascular damage. That's when the blocks, what we call, always say the patient is having 3 blocks, 4 blocks, all this starts at this point, vascular damage. Atherosclerosis or the plaque formation starts. The blood vessels become very stiff. The blood cannot flow. And all this leads to the disease, which where this process already started many years ago, and it was not identified or managed early before someone develops a ischemic heart disease, stroke, or heart failure and beyond. So how do we intervene? We know that vascular dysfunction is the final thing that happens before someone develops a serious illness. So how do we restore vascular health? So from understanding the disease, we are now moving into restoring vascular health. Okay, so let's look into these 4 pillars of vascular health. It's very heavy. I'm not going to explain everything in detail, but as we know the dysfunctions, what caused the dysfunctions, now let's approach vascular health in the similar manner, starting with endothelial function. How are we going to improve endothelial function? How are we going to improve nitric oxide production, reduce the oxidative stress, enhance the vasodilatation and vascular tone? Inflammation control. So what are we going to do? How are we going to reduce the C-reactive protein? These are the questions that we are going to ask and manage. Metabolic regulation, very important. As I mentioned, a lot of people develop illness starting with the insulin resistance, starting with diabetes. So we need to improve their insulin sensitivity, their glucose control. We have to help them with their weight management. And last but not least, circulatory support. How can we enhance the microcirculation, the small circulations that actually delivers the oxygen and nutrient to the body, to the tissues? So what can we do for a better circulation? So this is a very detailed explanation I have just run through in a more superficial way. So we understand that we need to address all the 4 pillars so that we can not just prevent, we can stabilize and reverse a vascular disease in this manner. What is more important is how do we apply these 4 pillars of vascular health when we see a patient? So let's translate the principles into a practice. So this is what now I'm doing. I believe a lot of doctors in integrative medicine are doing this way. First, metabolic optimization. So what we mean by that? We manage their glucose control. For example, I do what we call as continuous glucose monitor. I put on that device on a patient so we can see what actually affects the sugar spike, what kind of food is affecting them. And we teach them on nutrition. We help them with weight management. Without doing that, what is the point of giving many medications to the patient? Nothing will improve. And inflammation modulation. So we have to teach them on diet or nutrition that is anti-inflammatory. For example, we tell them take omega-3 fatty acids instead of taking omega-6 oil with high omega-6. We give them supplements. We manage their stress. Next, endothelial and mitochondrial support. What we do? We teach them on regular exercise, optimize their sleep according to circadian rhythm, micronutrient optimization. And the fourth one is what I'm going to emphasize more today, circulatory support. Physical therapies, we have EECP, enhanced external counterpulsation therapy, I'm sorry for that. Endothelial support, improving microcirculation, maintaining vascular function, right? And please take note, these strategies must be individualized and combined based on patient needs. We do not do everything as listed here to everyone. And it doesn't make a difference from a modern medicine approach, which is one size fits all. We are not going to do that. Dietary patterns, I'm not going to touch all of these factors in detail, but I cannot ignore dietary patterns. They are very important for us. So evidence-based patterns to improve cardiovascular health, Mediterranean diet, DASH diet, dietary approaches to stop hypertension. These 2 diets have been well studied. There are many clinical studies proving they have improved patients undergoing cardiovascular events, how it supports the heart and the cardiovascular health altogether. However, it may not be the only recommended dietary recommendation for everyone. We need to decide the dietary recommendations on individual patient needs, preference, and clinical context. And we have to align these patterns again in the same way how we look into metabolic dysfunction. So we have to manage the metabolic balance, inflammation control, and cellular or mitochondrial support through our diet. So I'm not going to go very detailed into this. Micronutrients, there's a whole lot of micronutrients I've listed down here, then there's many more. So I have to thank Dr. Prabhu for this. I've learned a lot about epigenetic corrections from his teaching and how micronutrients play a role in the process of methylation, what we call as using methylated vitamin B12, methylated folic acid. How does it support the methylation pathways, reduce homocysteine? Homocysteine is a toxin that actually starts a vascular injury. So how do we reduce that? I have to thank Dr. Prabhu for teaching me this very, very important knowledge. And of course, other common supplements that we start for patients with cardiovascular disease, magnesium glycinate, coenzyme Q10, omega-3 fatty acids, very important to reduce inflammation. Vitamin D, it is not just a vitamin, we call that a hormone because it supports our immunity and metabolic health. Silica, something newly we learned, silica has been an important thing to form collagens and also improve elasticity of blood vessels. Carnitine, again, supports the mitochondrial energy. So looking at it, again, when we go back, we look into the 4 pillars of how we treat improve vascular health. All these supplements play a role. But again, please take note, we must tailor the micronutrients according to individual nodes and clinical context. Okay, now let's move on. I'm not going to touch more on sleep and stress because I would like to focus a bit more on EECP, the treatment that we do more in our center. I'm working in a center called My Life Center in Petaling Jaya, Malaysia. Okay, so what is EECP? EECP, enhanced external counter pulsation. So what does that mean? If you can see, there are some cuff put on the cuff region, on the thighs, as well as on the buttocks around the hip. And what does it do? It's a very simple treatment where patients lie down on a bed and we put on all these cuffs so the blood being pumped from the lower limbs back to the heart. But it does not just happen when the patient lie down on the bed and then we switch it on. No, it doesn't. We have to connect the heart rhythm and monitor the heart rhythm, and the machine picks up when does the patient have systole and diastole. Systole means pumping of the heart, and when does the heart relaxes, which we call as diastolic phase. And this machine is a very smart machine. It only pumps when the patient is undergoing a diastolic phase. That means when the heart relaxes, only then it will pump and push the blood from the lower limbs back to the heart. So it supports what we call as diastolic augmentation, increased shear stress. It's quite technical. I'll just very briefly explain. So it stimulates production of nitric oxide, which actually cause vasodilatation and improve the endothelial function. And also in the long term, when we do it frequently, consistently, it can help to form collateral blood vessels, what we call as arteriogenesis. And with all this, the patient's heart gets some rest. The heart has been working very hard. We are trying to help with this machine to reduce the cardiac workload. Altogether, it improves perfusion and supports vascular function. So this is how the therapy looks like. An illustration, patient lie down. So sometimes people call this like a lazy man exercise. But yes, it is true, but not that they are lazy. Some people, they need this external support. This is a non-invasive therapy. It improves perfusion. It enhances endothelial function. So again, going back to our philosophy, this actually matches the philosophy of healing. And with this, we have been seeing a lot of people, almost everyone, have improved symptoms, reduced angina, improved exercise capacity. They come to us, they cannot walk, they cannot go upstairs, they cannot carry their grandchild. When we do this treatment, within 2 or 3 sessions, they are already able to walk upstairs, they're already able to carry their grandchild and go for a walk, right? So these are the experiences we gather from our patients. And of course, it improves quality of life, better physical function and overall quality of life. There are many studies supporting this. And this is just a caution that it is, of course, not suitable for all cardiac conditions. There are certain things we shouldn't give it. It's already listed here, like aortic regurgitations, arrhythmias, active thrombosis or bleeding, pregnancy. So in these conditions, of course, we need to do some testing. ECG, a proper echocardiogram. Sometimes we send them for a Doppler scan of the lower limbs. These are all important to make sure the patient is suitable for this therapy. Usually we do it over 35 sessions. Each time they come 1 hour, and advisable to do 5 days a week, so finish it in 7 weeks. This is the best recommended therapy. However, it comes with some issues where people have job, they are working, so we have to really, we have to adjust and help them. And sometimes we give letters to the employer so that they give them permission to come for this therapy. So supporting clinical evidence with EECP, there are many references, many research has been done in 3 different perspectives. Number 1, clinical outcomes. Yes, there have been studies showing improved symptoms and exercise capacity, enhanced quality of life. In terms of mechanistic effects, improved endothelial function and perfusion. In terms of system perspective, there have been studies showing multiple pathway intervention, improve outcome among cardiovascular patients. And targeting one pathway actually influence another. I would like to share a clinical case. We have got many cases, but I picked up one case which I find very interesting. In fact, I've just got his latest echocardiography last week. So I believe it's good to share this case for everyone's learning. So this is a man, Malaysian, 50 years old male. So he came to me because the cardiologist told him there's no other further intervention can be done for him. This patient have been having diabetes for the last 20 years, since the age of 30. And he has been taking insulin therapy with many medications and poorly controlled still. And this led to a cardiovascular disease, and in the end he had a heart attack at the age of 45, and he went for a bypass surgery with 3 major blocks. But what happened now? 6 months ago he came to me with a recurrence of cardiovascular event and graft occlusion. That means his bypass vessel has also been occluded. So now the cardiologist told him, you are already very weak, your heart is very weak, because the ejection fraction, or what we call as pumping capacity, is only 25%. It is severely reduced, and the left part of the heart is severely dilated. So with this condition, patient was having fatigue, breathlessness, and he was unable to move, unable to walk upstairs. He was taking many medications because there were no further intervention can be done, like stenting or another bypass. His medications were actually maximized, or I would say even more than a usual limit. For example, the patient was given a statin of 80 milligrams, where usually people take 40 mg, 40 milligrams, and already they develop a lot of weakness. And he was taking 80 milligrams. He came to me right in front of me. He was actually dozing off. He could not even talk to me, and his blood pressure was already on the lower, below the normal range because of the medication effect. So we have took an approach, as I've presented earlier, an approach not just with one therapy, but looking into everything else, the lifestyle, managing the medications, of course, adjusting the is modern medicines, adding on supplements, nutritions, teaching him on exercise, teaching him breathing exercise. For example, I taught him a 5-5-5 breathing exercise. That means he inhales for 5 seconds, hold it for 5 seconds, and breathe out for 5 seconds, and many more interventions. We spend a lot of time adding on with our therapy, the EECP therapy, for 35 sessions. So for now, by now, he has already completed more than 35, almost 38 sessions, because he really find it very helpful. So last week I sent him for an echocardiography. Yes, symptom-wise, he has improved even after 2 weeks taking treatment, but we are more interested to see the numbers, right? So from the numbers, I was very happy that his left ventricular ejection fraction, or the pumping capacity, from 25% has increased to 44 to 45%. I did not believe it. In fact, I asked the technician, can you please rescan? Can you please recheck? And he did that. He told me, doctor, don't worry, it is correct. It has improved up till 45%. And another important finding was the dilatation has reduced. From a severe dilatation, it has reduced to only mildly enlarged now. That means the left part of the heart, the size has reduced, the function has improved, and now he has a better quality of life. He can work without being fatigued. He can his exercise tolerance has improved, and he has a son who is only 13 years old. So he's very thankful that now he can focus on his family, on his son, not just about his illness, which has been bothering him for so many years. And this
Dr.
is,
Ramesh,
yeah.
your time is almost up. You have just a few more minutes.
Okay, sure, I will. So this is a single case, but with multifactorial intervention, and I have to clearly state, I do co-manage this patient with his cardiologist. I did not tell him please to stop his cardiology follow-up. I advise him to continue with the standard cardiology care. However, I have an oversight of everything that is being done so that it does not disrupt his recovery. So this is the same patient. So just a bit more clearer illustration. So the pumping capacity from 25% has improved to 45 in 6 months. The left ventricle has, the size has reduced from severe dilatation to mild enlargement, and is what we call it as symptoms, as all this fatigue, breathlessness, and minimal exertion as almost none currently. All right. So now let's go back to the philosophy of healing, and let's see whether the integrative cardiovascular model actually matches the philosophy healing. I believe so, because under this system, what we see, the body is actually self-regulating. We just need to support it. Health is bringing everything to balance, the dysfunctions to balance. The metabolic dysfunctions characterized by insulin resistance, mitochondrial dysfunction, inflammation. We need to bring it all under a balance using these 4 pillars of vascular health approach. So when we bring a balance, what happens? Disease is a dysfunction. So now we restore back the function. The person is getting an opportunity to be free from the disease. So when we restore function, the outcomes improve. So that's all my presentation. So end note, we move from treating the disease to restore function. And on the right side, this picture, actually I would like to show this because this was a gift from Dr. Prabhu, which I proudly put it on my table in my clinic, and all my patients look at it, they're very impressed. So Dr. Prabhu actually taught me epigenetics. So I proudly show this to everyone that I'm the first Malaysian student to be certified under Bioquantum Academy of Canada in epigenetic correction. I'm looking forward to do the further studies in diploma level and so on. And thank you everyone for the attention.
Oh, thank you, Dr. Ramesh. And I do have a question that is in the chat for you. So this is from Dr. Anji. So dear Dr. Ramesh, question. If we have 2 options, which one to choose first for drainage and detoxification for vascular health? Is it lymphatic system or any else? What terrain you can mention?
Okay, if I get the question correctly, which one to choose? No, again, our philosophy, as we have been mentioning earlier, it's about integrating. So there's no such thing as one is superior to another. So lymphatic drainage, though it is not actually vascular drainage, but yes, we do lymphatic drainage massage in my center for patients to improve the lymphatic drainage, which actually helps with detoxification. But that is not going to directly help with vascular circulation. We still need other therapies like EECP supported with micronutrition. So it all comes together. We have to do in a sequential way. If I want to explain a little further what we do in my center when a patient comes, first of all, it's all about testing, finding out the root cause. The second pillar is all about detoxification, which I did not touch much earlier because of time factor. But what we do detoxification in a manner, we reset back their gut. We give them probiotics. We may need to give them prebiotics, some parasite cleansing, followed by lymphatic drainage massage. Then we go for the therapies, starting with lifestyle modification, micronutrients, EECP therapy, And the last pillar, the fourth pillar, is always follow-ups. How frequently we follow up with the patients.
Thank you, Dr. Ramesh. So Dr.